Hi friends, the most commonly but most accidentally discovered disease is what? Of course, fatty liver disease. Nowadays, very commonly when we do a scan for some other reason, like if you are a female, you want to just check your uterus or you have some other health issues, then you see on your reports, oh my god, I have fatty liver, grade 1, you're really scared and you don't know what to do about it. And if you have had this in your reports, then today's video is meant especially for you. So, fatty liver or fatty liver disease, what does that indicate? Do I have to be scared about it? Because nowadays it's so commonly seen, there is a group of people who think that, oh, every other person has fatty liver, so why should I be bothered about it, and they didn't neglect it. And then there is another group, oh my god, I'm having fatty liver, I don't have any other health issues, then why did I get fatty liver? So if you belong to this category too, then today's video is especially for you. So hi friends, welcome to Homeopathic Care, we care for you, and I'm Dr. Jyothi Kannan. So today's topic is about fatty liver. So what is fatty liver? As the name suggests, fatty liver is a condition in which the fat accumulates in your liver. But see, before going to fat accumulation, you have to know two important things about liver. You know what is that? The first thing is the liver is the second largest organ in your body. What is the first one? Is of course your skin, because such a wide area it has to cover, right? That to your tall means more area. Then the second important largest organ in our body is of course the liver. Now why liver is the second largest? And if you think about it, that is because whatever you eat and you drink, everything is processed by your liver. If suppose by some means unknowingly something harmful goes inside your body, that is also filtered and processed by your liver. That's why you need a bigger liver. Of course, men liver is a bit bigger than that of women. That is a most important point to be noted. So if you have fatty liver, that is excess fat accumulation in liver, then do I have to be bothered about it? Of course you have to be bothered about, because it's an indication of your body that if you are not going to take care, it is just going to get worse and worse with the time. See, there are two types of fatty liver, that is alcoholic fatty liver disease, AFLD, and non-alcoholic fatty liver disease, NAFLD. Okay, so alcoholic fatty liver disease is, as the name indicates, your liver accumulates lot of fat because of your drinking excess amount of alcohol. And if non-alcoholic fatty liver disease, that is you are not drinking alcohol and yet you are having fatty liver disease, then that falls into the non-alcoholic fatty liver disease category. Now let's start with alcoholic fatty liver disease. So if men who take more than 15 drinks a week, and if women who take more than 8 drinks a week, they have more chances or tendency of getting this fatty liver disease. So please have a check on what you are drinking and how much you are drinking. So it's an important point, or your liver will not be going with you for a longer distance. So alcoholic fatty liver disease is because of excess alcohol. Then non-alcoholic fatty liver disease has been more common nowadays, and the reason being what, you know, the common major lifestyle diseases which we are facing. And what are those? Of course, the first being obesity, excess amount of fat in your body. So of course fat gets accumulated in your liver too. Then the second being diabetes mellitus or diabetes, type 2 diabetes, especially where you don't control your sugar is uncontrolled, and insulin resistance being one of the reasons. If you have high blood pressure, and most important, like if you are having high lipids, that is your triglycerides levels are very high and your high density lipoproteins, that is your good lipids, are very low. So in that case, these are the main reasons for you to get fatty liver. Other than that, if you are a person who is on medication with the steroids and corticosteroids and medicines like prednisolone you are taking regularly for autoimmune disease or allergy or asthma or whatsoever, then prednisolone is one of the medicines which can be having a side effect, can produce side effect, fatty liver disease. Then if you are not careful about your lifestyle. But there is a big category in which people fall nowadays, where they come up with fatty liver disease, who are young, who don't have any of these diseases like diabetes, hypertension or metabolic syndrome, and yet they have fatty liver disease. So this video is especially for you. Why do I get fatty liver when I don't have any other disease? It might be because of your high levels of your stress. So if stress is too high, then your body produces a stress hormone called cortisol. Now cortisol is a hormone which is produced from your adrenal glands, glands which sit as a cap on your kidneys produce cortisol. Now cortisol, when it is high, it is usually high when you are stressed out. That's why when you are too furious and you are stressed, your body produces two responses, flight or fight. So this response is also because of cortisol. Now cortisol is very high in your blood. Because of this stress, it affects your metabolism and you end up having either you are too hungry and you eat when you are stressed, or you have an increased craving for sugar, like sweets you want to eat, and you have too much craving for salt, and your fat metabolism and carbohydrate metabolism starts getting affected. Now these are the signs of your increased stress which cause this. This because of your excess of sugar, salt and sweets, and your excess of your eating of food and fats, high fats, you will end up with fatty liver disease. So if you don't have other diseases and yet you have fatty liver disease, it means you have to have control over your diet too, which is a very important part. Now nowadays young women are coming with fatty liver disease. If they are not getting their periods regularly and they just take a scan, they don't see, doctor, I have got PCOS, and then see, I have got grade 1 fatty liver too. I'm not that obese, and why do I end up having this? So PCOS is one of the reasons, that is polycystic ovarian syndrome is one of the reasons why you are being a risk factor of having fatty liver disease. So you have to take care about that too. But stress eating and PCOS. The third most important reason why nowadays generation is coming or falling prey to fatty liver disease is what you know, the fat diets and suddenly losing weight. Now when you try to lose your weight suddenly, it has a big impact on your body. You want to lose, oh my god, I lost 10 kilos. You are happy about it, but believe me, your body is not going to be. So have a good diet plan and stick on to it, and it has to be a gradual decline in your weight. It should not be like this, graph should not go like that. So that's one of the reasons. So these are the reasons why you get fatty liver. Now what are the symptoms? If I have fatty liver, most of the people don't have any symptoms in the initial stages. Now some may have occasional pain in the right upper quadrant of your abdomen, that is where your liver is. Then some may not have any symptoms too. But if you are not neglecting your fatty liver disease and gradually inflammation sets in, scarring and fibrosis set in, and you will go in for liver damage and cirrhosis, in that case you end up having like yellow color of your skin and yellow stool, pale stools, and nausea and vomiting like sensation, weakness, weight loss, swelling on your ankles and foot, and you will be having even ascites, that is swelling of your abdomen where liquids is filled into your abdomen. Okay, so not liquid, fluid is filled into your abdomen. So those are the signs of cirrhosis. So you have to be careful, then you don't want to push your body so that you reach till cirrhosis and you get it treated and corrected it initially itself. Now when you do a scan, if you feel that I have fatty liver disease, but how do I confirm, is it dangerous or should I do anything about it? Then that is where the doctor writes you for your liver function test, and if your liver enzymes are showing and not a good graph, that means that your fatty liver disease is progressing and you have to take care of your health and take medicines for it too. Then comes the last but most important point. If I have fatty liver disease, what should I do? The most important thing you should remember that you have to correct your lifestyle. So you have to stop the alcohol or limit the alcohol, increase more of your drinking water, and you should take good and healthy food. Now you have to keep everything which is white in color. Now what do I mean by white? The first thing is white rice, and the second most is the refined flour or the maida. But other than that, there are 4 S which I tell all my patients to keep away. The first one is the sugar, the sweets, okay, white of course in color. The second one is the salt, again white in color, not good. Too much of salt is not good for your body, always in limit. Third, the saturated fats. What are they? All the dairy and like if you are taking too much of cheese and all those kind of things, and you are taking red meat. like beef and mutton and all that, in that case this again triggers your fatty liver disease and makes it more worse. So saturated fats, and last, that is sugar, salt, saturated fats, and last one which we all love, snacks. Don't keep on snacking. If you are hungry, you can always take nuts or something so that you don't end up having too much fat in your diet. So these are the things which you have to limit, and you have to take care, eat more of fruits and vegetables and fiber and avocados. All these things is going to help your liver. Now once you have landed up with fatty liver disease, what do I do about it? I have got a mild pain here, should I take? Of course, take your medications. If you have sugar, diabetes or hypertension or all those diseases, bring it in control, take medicines for that. The best medicines which is going to heal you and which is very good for your liver too is homeopathic medicines. Now they go a long way and help you to come out of this disease. Along with a proper lifestyle and good homeopathic medicines, you can of course recover from fatty liver disease. So take care of your health. If you love my channel, then please subscribe, like, share my videos and stay happy and healthy. Have a good day.